Mr. Bell.
Thank you, Mr. Chair, and our witnesses for being here today. Speaking of preventable, over the past 7 months, we've witnessed a concerning and dramatic shift in public health policy under the leadership of RFK Jr. at the Department of Health and Human Services. This overhaul has included the removal of CDC Director, the Vaccine Advisory Committee, and now the widespread promotion of misinformation. The consequences of these actions are real and alarming, and the health of the American people, especially our children, face significant risk. One of the most pressing threats is the growing anti-vaccine rhetoric that undermines decades of scientific consensus and life-saving health policy. Vaccines have long been one of the most effective tools in preventing disease. Currently, the CDC recommends over 15 childhood vaccines to protect against deadly illnesses. Some of the diseases these vaccines help prevent include influenza, measles, and polio, to name just a few. The CDC has found that from 1994 to 2023, routine childhood vaccinations in the U.S. are estimated to have prevented over 508 million cases of illness and more than 1.1 million deaths. Before widespread vaccination efforts, diseases like polio infected over 457,000 Americans, causing severe paralysis and life-threatening effects. Today, polio remains a risk in only communities with low vaccination rates. Diseases like measles, which once caused over 880,000 deaths globally, have become increasingly rare. Research shows that with proper vaccination, the measles vaccine is up to 97% effective. Yet we are now seeing a resurgence. Over 1,400 measles cases have been reported in the U.S. this year across 42 jurisdictions under your watch. Reports from the CDC and Johns Hopkins have shown a decline in vaccination rates from 2024 to 2025, a trend that if left unaddressed will have catastrophic consequences. We're not living in the early 20th century, and we cannot allow disinformation to drag us backwards. Vaccinations are not new, and the science supporting them is clear, consistent, and decades strong. The current efforts under RFK Jr. to attack the use of vaccines is irresponsible and endangers the public health of our most vulnerable populations. Public health should never be a political tool, especially when the facts are so clear. So, Dr. Fink, as a physician, you do believe in scientifically backed medical practices such as vaccines, correct?
Thank you, Congressman. As a physician—
That's a real simple question because I don't have a lot of time. You do believe in scientifically backed medical practices such as vaccines, correct?
I need to clarify that because, of course, as a physician, I vaccinate my patients.
Okay, but and you
Of
believe in
course,
that medical—
Absolutely. And as a mother, I want to tell you—
you agree that vaccines save lives, right? These are easy. These are softball.
Absolutely.
Okay, well, that's great. Dr. Fink, and do you agree that when communities are ill-informed, that it makes them harder to make rational decisions regarding their health?
Communities deserve to have the best gold standard evidence-based information so that they can have—
when they don't get that information, it's harder to make a rational decision.
Absolutely.
Okay. After her firing, Dr. Monterez wrote in the Wall Street Journal, "If we stay silent, preventable diseases will return, as we saw with the largest measles outbreak in more than 30 years, which tragically killed 2 children." I ask for unanimous consent to enter into the record Dr. Monterez's full op-ed.
Okay, so.
Thank you. Now yield back.
Okay, Mr. Gill.